Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Bryan Roberts from Venrock. Bryan, always a pleasure to have you.
Thank you for having me. It's fun to see you.
Thank you. Likewise. All right. So for those who are not familiar with Venrock, give us a little short summary of what you guys do and who you invested in.
Sure. So Venrock was started about 50 years ago as the Rockefeller Family Venture Fund. Mm-hmm. And over the course of the last 50 years, we have invested in both technology and healthcare and at the intersection between those two, mostly early stage. Some of the investments historically, long ago, things like Apple, Gilead Sciences, more recently things like Illumina, athenahealth, Devoted Health, Grand Rounds, Castlight, things like that.
Awesome. All right. So I'm going to pick your brain about what's coming
Good
here.
luck.
Yeah, I know, right? It's not empty. It just keeps wiggling around. So it's like pinning it down is going to be hard. But I wanted to get your perspective on what you think is kind of coming and what you got your eye on for this whole new next decade in healthcare. So from your perspective as an investor, I mean, what do you have your eye on? Do you think that we're at an inflection point with digital health where things are becoming, a little bit more accepted by the healthcare incumbents, and so are you continuing to look at supporting that? Looking at the kinds of investments that you've made, a lot of the things that you've gone into, things like Devoted or Grand Rounds, it's like augmenting the system where it's at. Do you think that that's kind of where you're going to continue to focus, or are you going to look for some more leaps forward in terms of leading edge tech and disruption?
Sure. So I think the place we're at a tipping point is actually in value-based care.
Okay.
And risk. So I think that we've just gotten to a critical mass of participants in the ecosystem who actually want to take risk because they feel like by agreeing to take risk, they are also getting the responsibility to take control of both the services and economics around those services, and therefore they can deliver well on them. And I think that you will see risk proliferate throughout the ecosystem. So obviously, Devoted, the other Medicare Advantage startups, totally in the risk bucket, right?
Yeah.
Okay, but you're also going to start seeing it in places like Lyra Health, the diabetes reversal treatment, right? They want to go at risk. You're going to see it in Grand Rounds, offering great care, better pricing, stuff like that. So I think that's the number one thing that I see.
Okay.
I think probably conjoined with that is I see a movement from point solutions to really full stack programs. So a bunch of those companies I just mentioned are really developing the whole gamut, right? So that they can actually provide the entirety of a service, right? Which is both good from a brand and delivery perspective as well as a control perspective as well as a pricing perspective. Another group that's starting to do that in the mental health space is Lyra. Lyra Health. So started 4 or 5 years ago, and they're now essentially not only providing access to therapists and access to content, but the routing engine to take somebody who comes in and says, I need help. Okay, where should you go? Following them through the journey, getting to the other side, closing the loop, stuff like that. So those are probably the two big themes that I see going on.
How do you think this, I love what you're saying, and I want to dive a little deeper on this, how risk is going to change. Because, is this going to be the thing that maybe changes the payment model in a bigger way?
So I think it is absolutely currently changing the delivery model.
Right.
Okay? So I think you now have participants in the provider system of all different flavors, no longer thinking just about their specific little slice of the pie, but the patient more holistically, right? To both get better care, but also to lower the cost of that care, get to them earlier, get them to lower acuity settings, things like that. I think that I'm not sure it will ever happen that a patient will interact with a single person, a single provider. I think there will continue to be sort of a team of people who take care of any complex patient journey, right? But within that team, I think it's quite likely that one person's the person at risk, and the rest actually remain fee-for-service.
Oh, okay.
Okay? And their fee-for-service gets rolled up under the person who's at risk, but that person at risk has control, right, and directs the set of care. right? I think it's going to be harder to have multiple parties in the near term at risk in a single patient journey.
Okay. I think that's really interesting, really compelling.
Oh, thanks.
I really do. I haven't heard anybody put it that way, but it makes a lot of sense when you say it like that. So I want to ask too, as this is starting to happen, and as people are taking on more risk and taking on more ownership of the entire, care delivery spectrum, and you're saying going like full stack on it, right? The whole way. One of the things that we've started to see now is that there's a lot of startups that are later stage, and they're starting to acquire some of these little point solutions and integrating them.
Yes.
Right. It takes longer to do this, but we have right now a lot of later stage startups here kind of swirling around. Do you think, I keep hearing this is going to be the year of mergers and acquisitions and exits. Do you agree with that, or do you think that some of these companies are just going to continue to find financing in the way that they've been finding it, using venture capital or using strategic investment from different places in order to keep going?
So I do think that 2020, maybe 2021, will be a year that where winners and losers start to sort out. Okay, I think you'll see it in the MA space amongst those startup MA plans. Right, you've now got 2 or 3 years of market development under their belt, and some folks are not getting a lot of members, and some folks are getting a bunch of members. Right. So I think the rubber's hitting the road in a bunch of different segments of people trying to bring innovation into the healthcare delivery ecosystem. So obviously people get sold for 2 reasons, right? Things are not going very well and they don't get sold for very much. or things are going well and somebody large takes a really big strategic interest in those, right? I think you probably will see some more point solutions getting subsumed into the platforms, right? As they start to become a set of platforms, I think you probably see some of this in the care navigation space, right? There's a bunch of people fighting over that. You can call it the digital front door. You can call it the patient journey, right? There's a bunch of different folks from Teladoc to Accolade to Grand Rounds to Castlight, all trying to have that real estate and that relationship with the patient. And I think you will probably see them start to create whether it's partnerships or M&A, to add capabilities to their platform to make it much more all-encompassing. Because frankly, whoever the buyers are, payers, employers, they don't want to deal with 20 people, right? They'd much rather have one throat to choke.
One back to pat. That's what. Let's go with that. Okay. Instead of violence here. We see where your money is. You're like, no, the next will be wrong.
You got it.
All right. So last thing for you, I just want to know, is there anything that you are as an investor absolutely overseeing anymore? Like any kind of category here in health technology, digital health, digital therapeutic, where you're like, no, this is not the direction anymore, or anything that you're hot on right now? Where you talked about being full stack and fully integrated, but
I've still not gotten my arms around either wearables or digital therapeutics.
Okay.
Like I can see wearables. I have a tough time sort of seeing. I saw some graphic a month ago that said wearables sales were up amazingly in 2019, and they included AirPods.
Come on.
No, I swear to you. This was published. I'm like, I don't think that's stretching a little bit. So the digital therapeutics, there's a there. I just don't actually know how it fits into the system and when.
Okay.
And so I haven't been able to get my arms around it. So those are probably the 2 places.
Fair enough. All right. Great to talk to you. I love to hear your perspective on things. So different. I love it. Okay. All right. Thanks so much. I am Jessica DaMassa with WTF Health.